Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're going to talk about plantar fasciitis. What is this thing? What can we do for it? And what is the newest research actually saying? Now, before we dive into some new exciting research on plantar fasciitis and what you should really know and care about, I just want to remind you that we are always coming out with new episodes, especially topics like these and just exercises that you can do to really start to help and improve your body. So shorter videos, just getting you back in tune with your body. So if you haven't subscribed yet, please do, and leave comments on anything you know that you want to learn about, or if this is really fascinating, what was it that really surprised you about what we're going to talk about today?
All right, talking about a super common diagnosis, dealing with the feet plantar fasciitis today, which we did do a previous episode on plantar fasciitis that was all the way back, episode 22, where we talk more into what plantar fasciitis actually is, the physiology of it, what our tissues are doing in our plantar fascia, stuff like that. So if you want to get a little refresher, you can go back and listen to 22. And today we're just going to talk about some new research, some different interventions that actually might help, and all the exercises that we would kind of recommend people do in order to actually start building up more resilience and reorganizing their plantar fascia and really addressing the pain, which is ultimately the most important thing for most people. So plantar fasciitis, and again, we touched so much more on this stuff in the first episode, but I think the name itself is something that's a little bit of a misnomer, and we're talking about this in a lot of these itis or these inflammatory disorders, especially after, the first week or the first few months. It's not so much an acute inflammation anymore. There's actually changes in the tissue. We're getting thickening of our plantar fascia and really a lot of just disorganized tissue, which is probably the main issue.
So we want you to start thinking of this as not like, oh my gosh, there's inflammation buildup, and what can I do to take down inflammation, which we usually think, oh, I'm going to ice it, I'm going to rest it, I'm going to, by the time we actually feel these symptoms kick on, we're past that acute stage. Yeah. We've done some repetitive loading. We've done some repetitive things to that tissue that it's built up over time, causing this thickening and this disorganization. It's really just, where is your foot over and over again being placed that's causing repetitive strain and stress to the bottom of your plantar fascia.
Do you do a lot of repetitive standing? Are you doing a lot of repetitive behaviors like running or different things that are causing a lot of impact and loading over and over and over again? Mm-hmm. I mean, runners are one of the populations that we see this in the most. Close to 20% of runners,
pretty high,
at one point or another will report having significant plantar fasciitis that restricts their activities. What can we do to address this? And again, in the first podcast, we talk a lot more about the treatments that we would see as not as effective for long-term change. Yes. There's a lot that we can do to mitigate or help improve symptoms in the short term. That's where you would talk about doing different massage techniques, doing different icing or heat applications, stuff like that, that doesn't help with the long-term healing and the long-term reorganization and strengthening of these tissues, strengthening of our foot, but might help with short-term pain. So where do we want to start when we want to look at how can I change long-term so I can address and continue to do my own maintenance on this plantar fasciitis for life?
We see that especially more prominent in those who have a lower arch, and when your big toe starts to move inward. So getting that hallux valgus or that adduction, that inward movement of that big toe is they saw like a 22.2% reduction in blood flow to the arch. So now if we're getting a reduction of blood flow to the arch, we're not getting good muscle control. We're not getting good control at all of the bottom of the foot. And this could be, going down the road of leading to what we now know of plantar fasciitis. And we especially have this inactivity of the feet and this loss of awareness, perception, control of the foot, because we've been told we need to have very structured shoes that do the work for us. So they have the arch support for us. They have this stiffening of the shoe and just that forefoot kind of control, where we get this rocker action happening where our foot doesn't have to do the motion itself. The shoe kind of does the motion for you. It has a high heel. It goes down to the foot. You get that quick toe off, and you have this structure built in.
The conventional message that we've gotten a lot is you need to build up these external factors around the foot to help give your arch support, to help take load off the plantar fascia, to prevent too much movement or extension of the toes, which might, then stretch the plantar fascia too much and cause pain. And that's great in some cases if it helps, improve the symptoms in that short term. But the longer you use those shoes, the less your foot is going to be doing that itself, because we've got these intrinsic muscles, we've got muscles in our feet, muscles through our ankles that should be able to do all these for us. And that's that intrinsic factor where if we strengthen these things up, we have the components in our foot that can provide our arch with support and dynamic control, so that if we do pronate into more of a flat foot, we're still supporting through that movement. We have the intrinsic muscles that can spread the toes and the mobility that we should have available to extend those toes without having pain. But if we put them in shoes for years and years and years, or a couple decades, our foot is just going to continue to lose the ability to do that itself.
There was a study that showed that custom orthotics was less effective in improving pain and function than treatment of like manipulation, mobilization, and stretching for 2 weeks. That was just a ritual that was like kind of done. Someone comes in, they have foot issues, let's make them an orthotic, let's get them into a custom orthotic. And it's kind of looked at as this cool thing. Oh, my clinician made me a custom orthotic. And actually you can charge the insurance company pretty good money as a clinic to be able to get that custom orthotic, but we're seeing that it's not actually doing so much. And same with insoles, they're not superior, and it's been now studied and more research that it's really not superior in pain and function in the long term over conservative treatments that we're going to talk about.
Where should someone start? Like if someone's at home and saying, hey, I have plantar fasciitis, I've never heard of doing these things on my own, like what can I do?
In general, you want to get to know your own foot. And so we did create like a 2-week mini course that takes you through a self-assessment every single day. And it's 10 minutes a day where you self-assess something on your foot or ankle. And then you learn a couple exercises that you can do to kind of support that. And there's a lot of education that goes along with it as well, because there's resources and all this stuff. We'll drop the link for that below if you are having foot issues or concerned about having foot issues. Maybe they run in your family. They're really like you've seen a lot of people around you with foot issues and you don't want to stumble into that as well.
Yeah, I mean, and that's great for plantar fasciitis or anything else, foot, ankle,
we talk
toe
about
related.
So many different issues in the
those
foot.
like daily assessments really just help you learn about everything from your ankle to flat foot or high arch to how do my toes move to how do I walk or squat. And so there's so much in there that's just going to help educate you on how your foot and ankle operates and give you some tools, right within that Barefoot mini course to help address those.
I mean, it will literally tell you what you should be working on. One of the first places I always think of is just taking off your sock, interlacing them between your toes, and doing that for 5 to 10 minutes a night. Like, you don't need to go crazy with it. I know someone had reached out and like, I did it for 2 hours yesterday. And I'm like, why? That was your first time. 10 to 15 minutes. You don't need a whole bunch of time, but even just starting to open up and get that space between your toes can help so that we can start working those intrinsic foot muscles and building strength through that full range of motion.
People will like using toe spacers that you can buy. Our favorite is the Naboso toe splay because again, it's got a little bit slimmer profile, so it's not super thick between each toe, and it's also something that you can put socks over or wear and put in a shoe if you're going to go on a short errand or something like that.
Yeah,
and
they feel great.
Yeah, they feel great. And once you have done this toe spacing thing, immediately when you take it out, a great thing to try doing then is just active toe spreads. And it might not feel like you can do much because again, the first thing we need to start doing is building back up that brain-foot connection. If actively moving our toes or actively spreading our toes is something that we haven't tried doing for 10 to 20 years, it's going to be really hard to find that connection. But I promise you the muscles are still there, the nerves are still running down there, and there is ways that we can get back connected to those. But the best one is consistent attempts to activate and spread those toes.
We have to start loading the tissue. Now, this doesn't have to sound scary. This can sound like putting load through tissue can start with a stretch. So just, getting your foot and starting to pull your toe back so that you're putting some stretch through that big toe and through the bottom of your foot. Like that is the first type of load. Getting some load through the Achilles, through the calf, like getting some stretch that is a good place to start, especially if you're super sensitive at first. But we do have to start working back into doing things like heel raises and starting to load the tissue in a greater capacity than just stretching.
And then maybe you're going to go to putting your toes up on a small book or the front of your foot up on a small book so that you have a little bit of more depth you can get to strengthen through more range, and actually doing something like this, focusing on slow eccentric motion. So when you're coming down from that heel raise, focusing on a slow eccentric range, that has actually been shown to be more effective than just doing calf stretches.
Moving down the line, or even in preventative measures, like if you're doing heel raises with your shoes off, which hopefully sometimes you are, rolling up a small towel and putting it underneath your toes. So
just the toes, yeah.
Just the toes. So when you're going up into that heel raise, you're actually getting a little bit more range of motion into that big toe, which is going to put more stretch and tension onto that plantar fascia.
Absolutely.
And so we're really starting to then load things. Again, focusing on that really slow lower, whether you're doing it with 2 feet, whether you're progressing it to 1 foot, so incredibly important here. And we're seeing in general too, like it for preventative measures, if you lack ankle dorsiflexion, so your ability for your knee to pass your toe, if we're not getting into good ankle range of motion on a regular basis, this has the potential to be a risk factor for leading into plantar fasciitis. So just keeping, good, healthy range of motion from your calf and Achilles through full mobility and strength is going to be such a huge key factor for preventing plantar fasciitis.
Another thing we can talk about is single leg work. Once we're getting a little bit more comfortable doing single leg work that's going to challenge your balance and challenge you outside of your base of support. One thing we like doing is 6-way taps, where you're standing on 1 foot, you tap your toe in front of you, tap your toe behind, out to the left, cross over and go out to the right, and then you kind of rotate and tap in front and rotate and tap in back. That's going to get your foot really trying to react to that, unstable or unpredictable environment, and you're going to need to go into slight pronation, slight supination for that foot and that ankle to react to that challenge in balance. So again, that's another just kind of active exercise that is going to get our ankle, our plantar fascia actively working.
We do have to pay attention to footwear here. Now, if more cushion is something that, is really helping with reducing pain in the short term, keep that as a short-term thing that you're using, because really we want less of a heel drop, which means we don't want a really high heel. And a lot of even just running shoes, comfortable shoes that people wear, they're going to have a pretty high heel compared to what's happening at the forefoot. So we have to start looking at that. You want to start getting less and less of that heel, even to 0 heel drop, which is what Vivo Barefoot does, right? And even if we look at a wide toe box, sometimes they still have a narrow toe area. So even though it goes wider right where the balls of your foot might be, that's not enough, right, to make a typical shoe pattern, which should come out for that big toe and then have enough space for the other toes. And again, this is why we do like something like Vivo Barefoot shoes. If you have not gotten any, please do. Yeah. We have a 15% discount code.
It's a special for our podcast audience.
Yes.
It's all Jen and I wear. I'm somebody who early on wearing barefoot shoes, and here's something people do a lot. They're so excited to get their barefoot shoes. They take them, put them on, go work out in them, go run 3 hours of errands in them, come home and run 10 miles because they're like, that's what I normally do. But your foot is not used to that barefoot shoe yet. So getting your foot in them and just wearing them for, slowly increase the amount of time you're wearing them every day. There's a study that Vivo did where when people were wearing barefoot shoes most of their days for just 6 months, it increased the foot strength up to 70%, which is just insane that just changing that footwear really started to increase that intrinsic foot strength. And they specifically looked at big toe flexion, which having weak big toe flexion is a risk factor for developing plantar fasciitis.
We really bring these episodes because we want you to have that knowledge and education so that when you step into a clinic, you feel empowered to ask good questions and be able to guide your treatment to something that is going to be more effective. So please pass this episode along to anyone who's been told some of those treatments really do work.
Thanks so much for tuning in for another episode all about plantar fasciitis. If you haven't taken a chance to, please hit that subscribe button or the notification bell, because we have so many other PT Pro topics that come out, including the episodes that Jen does on different pain points or movement or mobility that's going to help support your body. Leave some comments below if you have plantar fasciitis or if you have any questions about what we just went over. And of course, we'll see you next time.